So the next thing I'd like to talk about in this video is pet CPR or cardiopulmonary resuscitation. I know a lot of you have probably been through human courses, and this is pretty similar to what you would experience in human medicine, but it is a little bit different because we are four-legged critters versus two. So first thing to think about in the scenario that you have to do CPR on your pet is try not to panic. I know it's difficult, but you're not going to do any harm by trying to help, because for all intents and purposes at that point, if their heart stops, they're dead. So all you can do is actually help them. So a few fractured ribs are not going to actually cause a problem in the long run. So that's the first thing to think about. Second thing is, on TV we sometimes see that everybody gets CPR, comes back to life, and it's not the case in real life. So a lot of the success that we have, or you're going to have if you have to do CPR, is the reasons why your animal has passed or their heart has stopped. So if you have an animal that's terminally ill or old, you're probably not going to have a very good chance of getting them back. Saying that, it's okay to try, but just have in mind that you're probably not going to be successful in that case. On the other hand, if you have an animal that, say, drowns or is otherwise healthy, gets a ball stuck in its throat, can't breathe, if you get all those things fixed and you try to resuscitate, you're going to have a pretty good chance you're going to get them back. So that's just going to really vary with the situation. So first thing to do in the fact that you have to do CPR on your animal is first assess to make sure that they are actually don't have a heart rate. So we talked about how to do a pulse. So you can check your femoral pulse again, like we talked about. Just make sure that their heart is indeed not beating before you try to attempt CPR. So if you determine they don't have a pulse, the acronym to remember is CAB, which is circulation, airway, and breathing. So it used to be in human CPR, which I think they've since changed it, but they've shown that early chest compressions actually save lives. So they recommend, before you do anything else, to do early chest compressions and then move to the airway and breathing portion. So when we're doing CPR, probably your animal's going to be on the ground. So is that rusty? Yeah. So we want to do it in right lateral, so on the right side with their left side up. Okay. And the easiest way to do this is to actually be towards the back. There we go. Good puppy dog. Be towards the back of the animal. So easiest way to remember it in a large dog is to actually do it the widest portion of the chest. That is usually rib space 9 through 10. And dogs have 13 ribs, so you can count back 13, 12, 11, 10. Or you can just look at where the widest portion of the chest is, and that's the right spot. So initiation of chest compressions, you're going to interlock your hands like this. Interlock them so your palm is down. And once again, over the widest portion of your chest. And one helpful piece of advice is to lock your elbows, because that's going to allow you to do this for a longer period of time. And if you've ever tried this before, it does wear you out pretty fast. So you're going to more use your body weight, and I'm not going to demonstrate fully here, but so you're going to do that and you're going to do chest compressions. I think the recommendation is 30 chest compressions initially, and then you go to assess the airway, which we'll talk about in a second. So once again, review widest portion of the chest, lock your elbows and hands, and use your body weight instead of your elbows like that. Use your body weight to push down the chest. So guidelines for chest compressions are to compress the chest about a third of the width of the chest. So that's just kind of an easy guideline, but you're probably in the heat of the moment, are probably going to be pushing hard, and just do the best you can in that situation. So second thing we move on is to airway. We're going to look and be careful not to get bitten, because an animal that's in cardiac arrest could be having a seizure and would have a bite that's uninhibited. So that could cause severe damage to you. And once again, safety of the provider is always of utmost importance. So you're going to check to see if there's any kind of obstruction, like if you have a tennis ball, something like this in the mouth. You're going to want to take that out, of course, because sometimes that can actually act as a ball valve, and when they breathe in, it's going to close the airway off, and then when they breathe out, it's going to push it out. So that's something to remember. Once the airway is clear, once the airway is clear, next thing you're going to do is you're going to initiate breathing. And once again, this is a little bit different from humans, because with the dog, it's difficult. You don't have a set of lips to seal over the top, and their muzzle's long, so it's more difficult to do that. So what we do is actually seal across the nose, and when we're doing breaths, we're going to just seal your hand over the nose and breathe through the nose and breathe. And if you have somebody to help you, that makes it a lot easier. But if not, you'll be able to see the chest rise. So just breathe until you see the chest rise, and don't breathe. Don't put too much force in there, because especially with a smaller dog, you could risk rupturing the lung. So my recommendation is to do like 2 breaths and then 15 chest compressions, 2 breaths, 15 chest compressions, go back and forth. And if you have a helper, 5 and 1 is a useful number to remember. 5 compressions with 1 breath. So hopefully you don't have to encounter this, but if you do, you'll be ready for it.
There you go.
I just wanted to add a couple additional things on for the CPR discussion of this video. First, if you have a small dog, a 2 or 3 pound like puppy or Maltese or something like that, you actually want to do the chest compressions directly over the heart. So that's basically the rib space number 3 to 4, and it's just right underneath almost right there underneath the armpit. So just right over the top of the heart. Once again, compressing about a third of the width of the actual chest. Number of beats per minute when you're doing CPR. When you're doing the chest compressions, you want to do no more than 100 to 120, because if you actually do it too fast, you can cause harm because you're not letting the heart fill completely. So doing it about 100 to 120 beats per minute is what we want. Breath should be about 15 to 20 per minute. So those are the guidelines for that. And this is one for the people that are more brave, that want to try something maybe a little extra. So I'm also an acupuncturist by trade for animals, and there's a point called GV26 in our terms, but basically it's just right here. It's called the philtrum of the nose, and you can see it on a human. It's right here. It's just right there, and if you have like a pin or like even a tack or anything you have to poke, you can actually poke that in that space and just kind of peck it like that, and that can actually stimulate the animal to start breathing on their own. So I've seen it work, especially on newborn puppies and seen it on a couple sheep that it's been effective on. And so, I would definitely recommend it if you want to try something a little bit extra.